You think it's just an age spot, but what if it's cancer growing on your skin right now? The truth is, skin cancer can disguise itself as something harmless. Don't be fooled. Skin cancer doesn't always scream for attention. It doesn't always itch, it doesn't always bleed. Sometimes it just sits there quietly, slowly spreading beneath the surface. By the time you realize it's more than just aging, it may be too late. Hi, I'm from Golden Aging Health. Today in this video, I'll share 5 warning signs to look out for skin cancer symptoms to age healthily. Stay tuned as I will reveal the ABCDE rule in the next part. Don't take chances. Don't assume it's nothing. Watch until the end. Your life could depend on it. Make sure to subscribe and hit the bell, because what I'm about to share is stuff you've been ignoring. But by the end, you'll know how to spot the danger. Don't miss out on your chance to save your skin. Why screening matters. Before we start, let's talk about skin cancer screening. The American Cancer Society reports that melanoma cases in people over 65 have risen 3% annually. Early detection can improve survival rates by 99% per milliampere Yo Clinic. I check my skin monthly and visit a dermatologist yearly. Ask your doctor. Should I get a full-body skin exam? We'll explain more about screening in the conclusion section. Warning sign number 1. Asymmetry in spots. First, check for asymmetry. Age spots, also called solar lentigens, are usually symmetrical, like a perfect circle. But skin cancer, especially melanoma, often looks uneven. One half doesn't match the other. Harvard Health explains that asymmetrical moles may indicate abnormal cell growth. If you were to draw a line down the middle of a normal age spot, also called a liver spot or a solar lentigo, both halves would typically match. These spots are usually round or oval, with a smooth, even appearance. But skin cancer, especially melanoma, doesn't play by those rules. Melanomas are often asymmetrical. One half doesn't match the other at all. It might look like a splotch, with an irregular or strange shape. In fact, one of the first steps in the ABCDE rule used by dermatologists for skin cancer screening is A for asymmetry. According to the American Academy of Dermatology, melanomas that appear with asymmetry are much more likely to be diagnosed at a later, more dangerous stage, especially in people over 60, who often mistake them for normal aging spots. Let me tell you about a man in his early 70s. Let's call him Frank. Frank had a spot on his shoulder that looked a little odd, but he figured it was just another senior skin change. It wasn't painful, it wasn't bleeding, but it was weirdly shaped, one side curved outward like a hook. His wife insisted he get it checked, and thank goodness she did. A biopsy confirmed it was an early-stage melanoma. Caught just in time. No chemo, no spread, just a minor surgery and a big relief. Tip: use a mirror to check spots. If one side looks different, note it and call your doctor. And tell me in the comments, have you ever had a mole or spot that just didn't look quite right? What did you do about it? We'll talk about the D in the ABCDE rule in section 4 and why one small detail could make all the difference in catching skin cancer symptoms early. Warning sign number 2. Border irregularity. Oscar-winning actress Jane Fonda has gone public with her diagnosis of basal cell carcinoma. She noticed a spot with irregular edges on her face. After removing it, she urged her fans to get checked. To be exact, normal age spots, also known as liver spots or sunspots, shave sharp, smooth, well-defined edges. They typically appear after years of sun exposure, especially on the hands, face, shoulders, and upper back. They are flat and their borders are uniform. But skin cancers, particularly basal cell carcinomas, squamous cell carcinomas, and especially melanomas, often appear with jagged, scalloped, or blurred edges. The borders appear to fade into the surrounding skin. Sometimes they appear ridged or even like a spreading ink stain. It's the B in the ABCDE rule used to screen for skin cancer. Irregular borders. According to the Mayo Clinic, these border changes are among the top 3 signs of skin cancer in older adults, especially when the spot appears suddenly or changes rapidly over weeks or months. Tip: trace the edge of a spot with your finger. If it feels irregular, ask your doctor, could this be a sign of skin cancer? Warning sign number 3. Color variations. Let's move on to the next warning sign: unusual or uneven coloration in a second or later. A typical lentigo, also known as solar lentigo, usually has a consistent shade, usually light to dark brown. It's consistent, predictable, and doesn't change over time. That's why it's easy to miss. But with skin cancer, especially fulminant, you can get multiple colors in one spot. This could mean black, gray, or blue areas, red or pink in the brown field, even white patches in older spots. That's the C in the ABCDE rule, color change. According to Harvard Health Publishing, color change in a lesion is one of the strongest predictors of malignancy, especially in people over 60. A study published in the Journal of the American Academy of Dermatology found that multicolored melanomas are 5 times more likely to be diagnosed at an advanced stage. My good friend Charles, a 72-year-old retired golfer, had what he thought was a typical sunspot on his nose, but after a few months, it developed a dark blue halo around the center and a little red on one side. The dermatologist scheduled a biopsy. It came back as an early-stage melanoma. Thanks to quick action, it was removed cleanly, and Charles did not need further treatment. Color is a signal your skin is trying to send you. When you notice different shades within a single dark spot, even if it is small, listen to that signal. Tip: take pictures of your spots monthly to track color changes. Do you have any discoloration spots on your body? I'd love to hear from you. Warning sign number 4. Diameter changes. As the saying goes, a small detail can make a difference. A small detail is exactly 6 millimeters. That's about the size of a pencil eraser. Here's the thing. When a growth is larger than 6 millimeters or appears to be spreading, it can be a warning sign of benign cancer or other forms of skin cancer. That's the D in the ABCDE rule, diameter. According to the American Cancer Society, more than 70% of melanomas diagnosed are larger than 6 millimeters at the time of discovery in older adults. This is because older adults tend to attribute growing spots to aging and delay skin cancer screening. Karen, 66, noticed a flat, dark brown spot on her thigh that was the size of a pea. She didn't think much of it until one day, while applying sunscreen, she noticed it had grown to about the size of a dime. It was smooth, painless, and not even raised. But that increase in diameter was a sign. She made an appointment with a dermatologist, and sure enough, it was early stage, spreading melanoma. Thanks to early action, it was completely removed. No chemotherapy, no complications. The Mayo Clinic notes that tracking the size of moles is one of the easiest and most effective ways for older adults to spot problems early, especially for those with fair skin or a history of sun exposure. Have you ever kept track of the size of a mole or spot? What changes worry you or make you believe it is harmless? Your sharing could save a lot of people. Warning sign number 5. Evolving spots. We've talked about asymmetry, irregularities in borders, color, and diameter. But now we've come to perhaps the most important warning sign of all evolution. Evolution means any change. Color, height, texture, feel, or even bleeding. According to the National Cancer Institute, rapid changes are one of the most important statistical indicators that a skin lesion may be malignant, especially in older adults. A viewer from our Golden Aging Health community, let's call her Maria, wrote to us about a rough, reddish mole on her upper arm. For years, the mole had been flat and looked like a typical actinic keratosis, which can be a precancerous condition caused by sun exposure. Then suddenly, the mole began to change. It became raised, darker, and began to itch and crust. Within 3 weeks, she noticed bleeding and felt a slight burning sensation. Thankfully, she saw a dermatologist right away. She was diagnosed with squamous cell carcinoma, a common but potentially invasive form of skin cancer. She underwent minor surgery and is now healthy and cancer-free. A study published by Harvard Health confirmed that evolution is the strongest predictor of malignancy, especially in older people with sun-damaged skin. Here are some things to watch out for. A mole that starts to itch, crust, or bleed. A flat spot that becomes raised or bumpy, changes in color, border, or symmetry even, if it's very small. A lesion that suddenly becomes tender or irritated. These aren't just cosmetic changes, they're your skin's way of raising red flags. So now that you know the 5 critical warning signs that can help you tell an innocent age spot from something far more dangerous, what should you actually do next? Let's quickly recap the 5 key warning signs that help you tell the difference between harmless age spots and possible skin cancer. Asymmetry. One side of the spot doesn't match the other. Border irregularity. Uneven, jagged, or blurred edges. Color variation. Multiple shades in a single spot. Diameter. Larger than 6 millimeters or growing over time. Evolution. Any change in size, shape, color, or behavior. If any of these signs appear on your skin or the skin of someone you love, it's time to take action. And the good news? Skin cancer is one of the most preventable and treatable cancers, especially when caught early. So here's what you can do today. Examine your skin under good light. Check your back, scalp, feet, and nails. Use a mirror or ask a partner for help seeing hard-to-reach areas. Take photos of suspicious spots to track changes over time. Write down any spot that bleeds, itches, or suddenly appears different. Book an appointment with a board-certified dermatologist if you notice anything concerning. Additionally, the American Cancer Society recommends use sunscreen with SPF 30+ every day, even on cloudy days. Wear a wide-brimmed hat and wear UV protective clothing. Avoid sun exposure between 10 a.m. and 4 p.m. Examine your skin monthly and see a dermatologist annually. Which of these signs surprised you the most? Have you had a skin check recently, or are you planning to get one now? Let us know in the comments. Your skin is talking. The question is, are you listening? If this video helped you see your skin in a new way, please like and subscribe to Golden Aging Health. We're here to help you live healthier, longer, and more confidently after 60.